1/5 of the leprosy cases report voluntarily. So we can only be sure that the number of new cases reported are less or more when we have made efforts to actively find the cases. And for the leprosy program, that one proverb always works, and that is seek and you shall find. This is how it works in the leprosy program. Thankfully and fortunately, Central Leprosy Division, Government of India, is promoting active case search, quality healthcare for the leprosy patients, prevention of disabilities, correction of disabilities, continued care even after release from treatment, scaling up of post-exposure prophylaxis for the contacts of the patients, stopping stigma, repealing the discriminatory laws, and at the same time keeping an eye on the antimicrobial resistance in leprosy. So now it is the responsibilities of the leprosy program managers at the state, at the district, and the block levels on how well they carry out the active case search during the NCDC campaigns, how good is the ASHA-based routine surveillance, the administration of single-dose rifampicin to the contacts, repealing of the existing discriminatory laws against leprosy, the awareness programs like SPARSH, and the subject of relapse cases and routine cases being sent for antimicrobial resistance testing. So India can move forward on the path of interruption of transmission of leprosy and a leprosy-free India only when the program managers put in their best efforts, their dedicated efforts, and their best foot forward.
In socio-economic development of our state, but by the grace of God and with the support of everyone, there is a peace in our land for the last more than 10 years. Once it was a troubled state, once we were headhunters, but the aims and objective of the present Nagaland is we are looking forward to hunt for peace and development of our state, of our region, and of our great nation. And as already stated, this state was created out of 16-point agreement, political agreement, and became the 16th state of this great union. And during that time it was 16 tribes of Nagaland. And 16 number, as you see, 16 is always a lucky number. If you see Indian mythology, it is all these diseases known to man. And it is stated that its origination or originated either in the Africa or Asia and reached to Europe through the conquering armies of Alexander the Great. Perhaps it was about 300 BC. And earlier, the leprosy disease is considered as a punishment for sin because it was a chronic and incurable disease until our times. Despite advances in all spheres of medical science, leprosy continued to be public health challenges and still occurs in more than 120 countries with more than 2 lakhs new cases reported every year. And if you see our country, India, this, as already stated by Dr. Mantal and Dr. Anil, the first India, National Leprosy Program was launched in the year 1954 and 55. And multi-drug therapy was used in 1982, and the National Leprosy Eradication Programme was started in 1983. And remarkable progress have been achieved. However, as already stated, India being the largest population and 1.3 billion Indian can't be wrong. So India continues to be the highest leprosy cases. As of now, it's about 75,394, of which consists of 53.64% of the total leprosy cases, followed by the country of Brazil, Indonesia, Democratic Republic of Congo, and Mozambique. In the current prevalence rate of leprosy, as per 2021
Nagaland TV, Sob Manulaga Awas. Watch us live on GeoTV and on your television sets as well. For Dimapur viewers, we are on channel number 994 in Global Chapter, and Kohima and Mokokchung viewers, switch to channel number 138 on Hornbill Digital. For all news and updates, follow us on Facebook, Instagram, YouTube, and Twitter.